3,500 of new cases are diagnosed in the Philippines every year. And in children, 10 cases are diagnosed every day. And 2/3 of these cases are in advanced stage. Less than 20% of these children survive.
1 out of every 2 men and 1 out of every 3 women will be diagnosed with an invasive cancer in their lifetime.
3,500 of new cases are diagnosed in the Philippines every year.
And most of them are diagnosed in the late stages.
But before we look at what causes cancer, we must first understand what it means.
Cancer is basically a disease that involves the abnormal growth of cells.
These cells can then invade other parts of the body, multiply and produce new tumors.
So I'm Dr. Carmelita Calahong, a subspecialist of hematology. So I'm a pediatric hematologist. So I'm taking care of children with cancer. To improve survival and reduce the cases of late diagnosis, Corazon Locsin Montelibano Memorial Regional Hospital, together with other health agencies, has provided and has laid down their efforts to help these children with cancer.
Nagpa-consulta kami kay hindi na ako to kalakat mo. Tapos, gatobo mga lagobla sa akong mga lawas. Una-una naman ng konsulta kay Dr. Kalangid mo. Hindi pa ko to kalakat mayo. Kiyang-kiyang lang ako to.
I started taking care of these children at Corazon Locsin since 1998 up to now. The common childhood cancer worldwide is still leukemia. Leukemia is a blood cancer. Usually, patients will present with fever, joint pains, bleeding, lymphadenopathies, big spleen or big liver, and others. Aside from leukemias, we also see patients with lymphoma. Lymphoma is a malignant growth of lymphoid tissues or cells. Patients will present with loss of weight, fever, fatigue, and lumps. Retinoblastoma is also seen here at Corazon Locsin. It is an eye cancer, and a light reflection at the center of the eye will look like a pink or white instead of the normal red-orange color. Aside from that, we also see brain and spinal cord tumors. These kids will present with headache, nausea, vomiting, difficulty in walking, difficulty in holding objects, and seizures. Aside from that, we also see bone and soft tissue tumors. And these children will complain of pain and swelling. Favorable outcome will depend on prompt diagnosis and early treatment.
Isang 6 years old ko, na-diagnose ko sang acute lymphoblastic leukemia. Sa ito nga time, kada semana, balik-balik kami dire sa ospital para lang magpakimo. Pag isang na-admit ko, nagpatugong kami dugo. Nabala naman ako nga para sa akon, para magayo lang ako mo. Kaya gusto ko, sa una nga magayo ko. Ginpate ko sa ako naman. Nang una, nadukan ko mo. Nauya pa ko sa mga tao nga ara sa akong tubang. Kaya, though first time mo lang kita, tao nga may mga sakit. Nalipay man ko kay na-meet ko gids na kag-mayo man sila sa akon.
In treatment, we always follow the shared decision with the family. We are open to conversation, to questions, to discussion with the family. to provide them the best treatment option. So, treatment may include surgery, chemotherapy, or radiation therapy depending on the type of cancer and stage. Treatment is participated a multidisciplinary team. The doctors, the nurses, the social worker, and other allied health workers for it to be holistic. For children and their families, we also seek the help or the services of like the physical therapist, the dietitian, and other health support groups.
Ang dumduman ko sang pag-admit ko dire. Mudamo ko na meet nga good peoples dire sa ospital. Kag sa chemo room naman, damo naman ko to may namigo ag mga nurse man. Bale pag sulod ko sa chemo room, balang ko gid nga ginakare gid ko nila mo. Kag do ginalagaan gid ko nila blang mayo gid ko. Bale do sila na gid ang second family ko bla sa akon sa una bla. Kay kada semana paano ko mo chemo, te bale sila lang bla do pasadya sa akon dapat. Kada
Corazon Locsin as a center for cancer care will be established as a basic comprehensive center for cancer care so that we will be able to expand our services, which will include child psychology, survivorship, and quality of life clinics. Stakeholders, including the Balay San Jose, who serve as the halfway house for these children, the LGUs and the management for their dedication in helping these children.
thank you gali sa tanan nga nurse kag sa staff sang hospital kag sa mga doctors. Kung rate ko ang pag-asikaso nila sa akon yung 100/10 kay balang ko gid nga do ginaplangga gid ko nila bla do utod nila do bata nila sa may mga cancer subong ng lang gid kamo ng stay strong lang gid kamo tanan kag God bless.
In Corazon Locsin, Montelibano Memorial Regional Hospital, we are continuously trying to improve the quality of cancer care of children. We have subspecialists, we have different services and support programs. Give your children with cancer a chance to life or to live, because cancer in children is curable.